It's killing more people than cocaine, meth, and heroin combined, an average 22,000 deaths a year. Chances are you know someone who's hooked on prescription drugs. A new federal study shows a 400% increase in people going to rehab for prescription drug addiction. The study spanned a decade from 1998 to 2008, and it shows the spike covers every age, gender, race, ethnicity, education, employment level, and region. New at 10, KXAN's Erin Cargile discovers local drug agents paying closer attention, and she investigates why the state's monitoring program has room for improvement.
Our medical detox facility can definitely help you with the help your son withdrawing from the heroin and the opiates that he's using.
Being a new mom is supposed to be joyful, but 6 years ago, Julie's life went downhill.
After I had my daughter, I had severe feet pain.
Over-the-counter pain relievers weren't cutting it, so she went to the doctor.
He's prescribed me a real low dose of it's Vicodin, or what is hydrocodone.
Her tolerance quickly surpassed 2 pills a day.
It was quite fascinating how easy it was to get more from my doctor.
6 months later, Julie's doctor prescribed a stronger painkiller, Percocet.
I was going to several doctors, getting different prescriptions in several pharmacies, getting them filled at different pharmacies, and it became a full-time job just to manage my addiction.
Julie's doctor shopping could have been detected under the state's recently expanded prescription monitoring program. In 2008, new legislation required the Department of Public Safety to look for patterns of abuse on a larger number of addictive meds. Pharmacies submit prescription data on hydrocodone, such as Vicodin, muscle relaxers like Valium and Xanax, and cough syrups with codeine.
We had no idea that it was as bad as it is. There's a lot of folks that are engaged in this crime.
So far this year, they've helped with more than 2,000 investigations. DPS, doctors, pharmacies, and law enforcement can all access what you've been prescribed, how much, and who prescribed it in the last year. Patients aren't the only ones under the radar.
If there is a doctor writing scripts for those types of medications more than any other, or a pharmacy filling them more than any other, then that may cause us to take a look.
The program is working, but not as well as it should be. Requests for information have to be in writing. Responses come the next business day. Immediate access to a patient's history is often needed, especially in the ER. Program Administrator Patrick Canoe says 24/7 online access is in the works. The data is also key for the Drug Enforcement Administration, who just added a pharmaceutical team in Austin. Federal agents already have their hands full going after organized groups stockpiling pills to sell on the street and online.
The drug of choice for first-time drug users is now prescription drugs, whereas it used to be marijuana.
But for many, there is life after addiction. Julie now works at Austin Recovery, helping others get clean.
I probably receive 10 phone calls a day just for prescription pills, and it's people saying, I don't know what to do.
A daily reminder of where she once was, but grateful to have 4 years of sobriety under her belt. Erin Cargile, KXAN, Austin News.
The National Drug Control Strategy released in May outlines several steps to address prescription drug abuse. We have those outlined with this complete investigation at KXAN.com.